In this video, we'll do something a little slightly different from the ordinary, right? We are going to talk about a skin condition popularly known as eczema, but typically we call it atopic dermatitis. So sit back and relax, and I hope you enjoyed this episode. Hello and welcome to the Dr. Amaka Nnamani show. If this is your first time here, welcome. Please subscribe and like and share with moms in your life that you think this will benefit. Okay, I'm a board certified pediatrician practicing here in the US in the state of Pennsylvania. All right, so let's get right into it. We, in the past have talked about most, anticipatory guidance around regular visits, but I've had a lot of questions from moms about different things. And I thought, we'll start doing more of these types of things, and we'll see what you think. And I'd love your feedback. Put it in the comment section and let me know how this is helping you. All right. So today we'll talk about a skin condition most people popularly know as eczema. Right? In the clinical world, we call it atopic dermatitis. So really, what is eczema? What is atopic dermatitis? It's a skin condition where, children tend to have like rough, bumpy skin. There's lots of reasons for it. We think there's some reasons for it. There is some immunological response. There's a lot of times also a genetic component to it, but it's also not uncommon, right? It tends to look different in different skin types, right? So if you're African American, it will look different than if you're Caucasian, and if you're Asian, or just different culture types just tend to have the skin look different depending on where you're from, right? So it's important that we know how we can take care of the skin. Right. So again, when you see a rash on your child, you want to make sure that that's evaluated by a pediatrician, right? Because we want to make sure it's not something else, right? We have what we call differential diagnoses or other things that it could be, things like scabies, lice infestation, flea bites, other things really could look like eczema or atopic dermatitis. And you want to make sure that that's really what it is. When we've confirmed that and okay, well, I know my child has eczema, now what, right? So we really want to have a maintenance regimen, right? And so what does that mean? That means there are things that you should be doing for your child's skin to reduce your chances of having an acute flare-up, right? So skincare, really, it's important that you are using fragrance-free products on your child's skin. So that includes fragrance-free detergents. So you want to buy products that have, let's say, free and clear of dyes or of scents. So anything that's fragrance free, you want the brand really doesn't matter, honestly. Most times you just want to make sure it says free and clear, right? So that also includes body washes. I typically don't recommend bars because those tend to be drying. I tend to recommend more washes that are creamy and for obviously, like I just mentioned, fragrance free. Right? And then moisturizing is such a huge part of your child's skincare. So when your child takes a shower or a bath, you want to pat dry, right? So you want to make sure that when your child's done with their shower or their bath, that they're still moist, right? Because the dampness helps to seal the moisture. And then the product that you use to actually moisturize your skin, your child's skin, is as important. So I typically tell my patients, you want things that you can scoop out of versus things you can pump, right? What does that mean? Typically lotions will not work. Why? Because lotions are water-based. You want things that are oil-based. So things like creams, ointments, jellies. Most times I recommend petroleum jelly because it's nice, thick, and not as messy. I always tell my patients and my kiddos, you really want to be able to glide through the skin when you're done moisturizing, because your child may be shiny for that first 1 to maybe up to 5 minutes, but within a few minutes, your skin dries out. And it tends to be worse in the winter time. So you really want to even ramp up that moisturizing in the winter time. So at baseline, you want your child moisturizing at least twice a day. In the winter time, I say ramp that up to like 4 times a day, maybe even more. Right? And then when you do laundry, no dryer sheets. Right? Because again, those usually have fragrance in them. And then the clothing that your child wears is so important. So you usually want to have things that are 100% cotton. or at least most cotton, right? So things like polyester or a lot of other products would be irritating to the skin, especially in the wintertime, where the temptation is really to have your child wear fleece clothing to keep the child warm. Now, it's okay to wear those, but whatever is directly touching your child's skin should be 100% cotton. So you can buy a cotton onesie or shirt, right, that your child puts on directly on the skin, and then they can put a fleece sweater or something over it, as long as what's directly on their skin is 100% cotton, right? And then for those times when your child has acute flare-ups, you sure want to have be evaluated by your pediatrician. A lot of us will do a hydrocortisone. You have a mild potency, medium potency, and you have a high potency, and that's for us to decide depending on how severe your child's skin is. Right, and eczema can look different in different stages of life. So really, if you're thinking your child has eczema less than 2 months of age, for sure you want to have your pediatrician evaluate that, because we also want to make sure there's not something else going on, especially if the child is less than 2 months. Is it truly really eczema? And second, if it is, we may want to have your child evaluated by an allergist or an immunologist. Now, if your child's older, then we talk about that maintenance therapy, what to do in acute flare-ups, and then you also want to make sure that you are looking out for signs of infection, right? And what causes infection in your child, right? It's usually when the skin barrier is when there is an impairment in your child's skin barrier. So your child's so itchy, they're scratching, and then that can become super infected with skin bacteria like staph or strep. And then for sure you want to see your pediatrician, because then we want to rule out things like what we call cellulitis, which is an inflammation of the skin or infection of the skin. Depending on how widespread it is, your child will probably need topical, which is like, just limited creams, ointments, antibacterial ointments, and or if it's more widespread, your child may actually need systemic or oral antibiotics. So you want to look out for that. And then what we call lichenification, which is where your child's skin thickens so much from all that scratching and, the eczema flare-ups, right? And that's really, we try to avoid that by having a good maintenance therapy. And a lot of pediatricians will actually offer you like an eczema action plan of your green zone, your yellow zone, and red zone, and what to do in different stages. Your green zone is where you want to be, where your child's skin is mostly looking great, right? Less bumpiness. Your child's not itching all the time. Because if your child's itching, your child may also need like antihistamines and, all those kinds of things, really just to help with the itching. But again, you want to see your pediatrician and not, just assume that you have it all figured out, right? So in this video, we've talked about really what's eczema, what may cause it, right? We've talked about what it looks like. It looks different on different skin types. In Black and African Americans, a lot of times the skin looks lighter, like you have those lighter patches on the skin. We've learned that we need to avoid products that have fragrance on it. We've learned that we need to make sure your child wears 100% cotton, and we've learned that moisturizing is really key to your child's skincare. And really, I say you can't really over moisturize, really. So when in doubt, put some petroleum jelly on that, right? Just slap it on, especially at bedtime, before school, at least once during the day. And the product that you're using to moisturize is also important. You want things that you can scoop out of. So you want jellies and creams and ointments, and not so much lotions, because those are water-based and will not do much for your child's skin. So I hope this video was helpful. If you have any questions, put in the comment section. And let me know what else you want to hear about. But until then, until the next video, toodles, remember, preparation over perfection always. Bye.